All right, everybody. I hope you guys can hear me. I'm Chris Williams, one of the partners at Hopler, Williams & Hanna. We've got a law office in Durham and a couple of other locations in the Triangle and Sand Hills regions. I am joined today by Barbara Patterson. She is our guest speaker. She is with Bartlett Reserve, which is a independent living community. And Barbara has been in the senior care industry since 2006. So rough 14, 15 years now, and is a director with Bartlett Reserve. She's got a political science degree, loves working with people and finding solutions to problems. Barbara has been in the home care industry, the independent living industry, assisted living community industry. She lives in Fuquay with her husband and her teenage kids, and has some cats that are named after candy, I think. And Barbara is just basically our local expert on things regarding seniors' options when it comes to living. And so I'm going to share with you her PowerPoint presentation and let her take over. And Barbara, whenever you want to change the slide and I'm not catching on that you want that, just let me know.
Got it.
Also, as far as questions are concerned, you can put questions up in the chat at any point. What we'll probably do is have Barbara go through the whole presentation. And if those questions don't appear to be answered from her presentation, I'll bring them up and we can address them. So Barbara, without further ado, I am going to turn things over to you. If you will bear with me just a moment.
All right. Excellent.
All right.
Well, Chris, thank you for having me today. I feel very passionate about discussing the options that we are all going to face if we're lucky enough to live long enough to have to make these decisions. I think in the 15 years I've been doing this, the thing I have encountered is we don't plan. We don't think about it because we think we have lots of time. And I'll tell you, in my own personal situation, the years go by really fast. So today we're going to talk about the options for senior living. And there is this myth, and myth is not the right word. No one tells us this myth, but we tell ourselves this myth. And the myth is that we don't need to plan because when we need it, care will be there because we have insurance. We have insurance we're taken care of. And so I cannot tell you how many families I have sat down with, and they are shocked and surprised when we're looking at the cost and that insurance does not cover this stuff. So before we go further, your insurance will help you out a little bit as you age. One of those options is home health, and we'll talk a little more about that as we go further. Home health is set up to help you transition. If you've had a hospital stay, it is to get you back home safely. It's physical therapy, occupational therapy, speech therapy, a nurse visit, and occasionally an aid visit. And again, we'll talk on this as we keep going. Insurance will help cover for skilled nursing, the rehab portion, hip replacement, knee replacements. Again, sometimes just a really bad illness where you're flat on your back in the hospital. A week can truly take years off of your mobility. So sometimes a hospital stay gets you into rehab and insurance will pay for a certain amount of days. And then last but not least, hospice services. Either inpatient at a hospice house or having those services at home. Those are things right now that insurance will give you some coverage for. As we age, we face many obstacles. Depression and suicide. Depression is so high in our senior population. And I think as a world, we have seen that with COVID this year. Just the depression that has hit everyone being locked up in their house, but especially our seniors. Social isolation. Again, COVID has brought this to everyone's attention. But as we age, as our loved one, our spouse passes away, we start seeing our best friends pass away, and our circle grows smaller. And it's easy to become very isolated. Substance misuse and medication adherence. Differences there. First of all, we love to diagnose ourselves and treat ourselves. I have a friend who has had 2 strokes and is weaning himself off of his blood pressure medication because he's lost weight and doesn't feel like he needs it. And he's doing that without a doctor's supervision. And I'd love to tell you he's alone, but he's not. Mismanagement. A lot of us go to multiple doctors, multiple pharmacies, and we don't always get our records pulled together. And so we have ran into many health issues. I had one here with a resident. She had been prescribed the same medicine by 2 different doctors under 2 different names, and it took an illness for someone to realize that she was double dosing. Pain mismanagement. So many people live with pain because they don't realize there's treatment options available for them. And then so many people medicate themselves with all the wrong things. What can that cause? Dizziness, falls. Falls are so huge. A fall can be a life-changing event for any of us. Home safety. We love our homes. We've lived in them for 30, 40, 50, sometimes 60 years. But what hasn't changed in those 30, 40, 50, 60 years is putting in ramps, expanding doors, bedrooms on the bottom floor so we don't have to walk up a flight of stairs. All of this, again, leads into falls. Poor nutrition. It stinks to cook for one person. It's expensive. It's not fun. You're not getting the praise. And so what happens is a lot of us, as we age and as we quit cooking for our families, we start eating out more. We start eating less healthy things. Unsafe driving. Not even going to touch that one. That's probably the hardest obstacle seniors have to deal with. Family dysfunction. Not every family agrees on what should be done and how it should be done. I'm sure Chris could chime in and share days worth of stories on that. But that can also lead into some abuse. There are many, many seniors out there, not just physical abuse, but verbal abuse, not getting the help that they need because kids want their inheritance. Challenging behaviors and wondering what we'll talk about some of that as we go forward. So what are your options? We're aging, I'm aging, and you start thinking, what will my future hold? Well, the first option is to stay at home, in that home you've had for 30, 40, 50, 60 years. What are the benefits? It's comfortable. It's familiar. You don't have to change your routine. You know your neighbors. You know how to get to the drugstore, to the grocery store. It's just easy. The disadvantages of this, again, most homes have not been upgraded for senior. Easier access, the showers. If you're still getting into a big bathtub, stepping in and out, that's a huge falls risk. Upkeep on a home. In independent senior living, the biggest reason people come here is they are sick and tired of things breaking, plumbing issues, the roof, the lawn needs mowing. So there's a lot of work that has to be done to keep a home functioning and going. A big thing we see is there's no one around for emergencies. And I'm sure everyone on this call today has probably heard a story of someone who laid on the ground overnight, 16 hours. I've heard of a couple of days because there was no one there checking on them. Another disadvantage, we talked about it earlier, just that loneliness. And it is expensive, even if you own your own home. A lot of people say move into a community is expensive. But when you factor in all of those things that we just talked about, plus your property insurance and taxes, it's expensive to stay at home as well. So this kind of leads in, if you're staying home, you can get help in the home. And So I think it's really important to talk about home health versus home care. And I tell you, if you take nothing away from this, this is one of the biggest educational pieces I do out in the community, because so many doctors don't even truly understand the difference. When a doctor writes an order, he is writing an order for home health. And home health is not meant to help you age gracefully in your home. It is for a short-term need. So there is a definite end date for home health. It's to give you time to heal, to regain your strength. And as we spoke earlier, it is your physical therapist, occupational therapist, speech, a nurse, and occasionally, depending upon your situation, you may have an aide. These are sometimes called CNAs, for certified nursing assistants. They're also referred to as a PCA, different terms, but it's all a caregiver. And if home health is covering that, it is coming in to help you with a bath and to change your bed linens. They're not cooking for you. They're not helping you clean your house. They're not driving you to appointments. It's about an hour visit if they come out. And again, insurance will have a set number of days or times that they will cover. Home care, go back one more for me. Go back one, Chris. Home care is what we used to be called private pay. And you do not need a doctor's order for home care. Home care can do a variety of tasks. It is private pay. And if you have long-term care insurance, very different than your health insurance, long-term care will typically cover for home care. Now, here is an exciting note. Some of the Medicare Advantage plans this year have started to pay for some home care, but it is very, very limited. And it is a very select number of plans that are covering. I do foresee in the future that insurance will start paying for more home care. As we have, changed over just the last 10 years, I think there has been such a push to keep people out of the hospitals. And so doing things in the home will help with those hospital visits and stays. And so I hope as we progress as a country, that insurance will start paying for more of that. But home care is companionship on up to full hands-on care. So now you can switch over, Chris. Benefits of home care. Now we're not talking home health, home care. You can get as much or as little as you want. I will tell you that most companies have a minimum number of hours that you have to purchase in order for a caregiver to come out. But your schedule can change every week. You can have 10 hours a day for this week, and you can have 2 hours a day for next week. Respite care is available. This is here to help people. A wife is taking care of her husband, but her grandchild is getting married and she needs to go out of state, wants to go out of state to be part of that ceremony. And her husband is in no condition to travel and go. So respite care, someone can come in and stay for 4 or 5 days, give her the freedom to go to this wedding. And then once respite is finished, you don't ever have to purchase care again. There's no long-term contracts. It will allow a spouse to be that primary caregiver, but it will also give that spouse a chance to take care of themselves and to take care of household responsibilities. Why is that important? You know, if you have to unload and pack up a wheelchair and you need to go to the drugstore, to the grocery store to get your hair done, that is a physical task, folding and unfolding, folding and unfolding. And so many times, if someone doesn't have some assistance, it's not worth doing it. So they stop doing some of those things. It is one-on-one care. And we'll talk about that when we come to assisted living and comparing the differences. But the biggest benefit of home care is it allows you to stay in your home as long as possible. Moving on, what types of assistance are available? Companionship. If you want someone to play cards, games, read to you, watch a movie with you, take you, you can't drive anymore, so you're not going to Bojangles and meeting with your guy friends to try to solve the world's problems. A caregiver can help bring that back into your life. They can help you with meal planning and preparation, doing your grocery shopping, running errands for you, doing some light housekeeping, and some pet care. Pets are super, super important in our lives. And as you age, you don't want to give up that companion and that friendship. So, but walking a pet can get harder. Changing a litter box can get more difficult. So a caregiver can step in and help with that. And then a big thing you're going to hear as you age is ADLs, ADLs, ADLs. That stands for Activities of Daily Living. And this is things like ambulation, bathing, dressing, grooming, incontinence care, transfer, so helping someone get from a wheelchair to the couch, bed to a wheelchair. Cueing and behavioral needs, and so this is really with our people who are having some cognitive issues. A lot of people can do their task, they just forget they need to brush their teeth. As some of these cognitive diseases progress, they forget that toothpaste needs to go on the toothbrush. But just a little bit of cueing, a little bit of assistance, and they can take care of themselves. And then medication reminders. Medications are probably the biggest reason that a person has to go to assisted living. Either they cannot manage them, and I will tell you, coming from a hospital, sometimes we would discharge people and they would have 3 full pages of medications. That is hard for a 30-year-old to keep up with. So that definitely does not get easier for an 80-year-old to keep up with. And then, so many of the patients I've worked with in the past, they get medications 5 times a day. So remembering to take all of those medications in the orders that they need to be taken is a huge quality of life factor. With home care, you can get a higher level of care. So nursing services, and again, everything I'm going to talk about today, every company is different, every community is different, but a lot of home care, you can get nursing services. So for the diabetics, if they need help with their blood sugar checks, anyone who needs tube feeding, catheterization, wound care, medication administration. And so that is a nurse. A nurse can come in and completely set up your medications for you. They can call your doctor, they can get them reconciled and know what you should take, when you should take it, and then set up a pill box. The Monday through Sunday boxes that we've seen, those get very big, and you can have 8 a.m., 12 noon, 5 p.m., 9 o'clock. So they can take over and manage all of that when your medicines run low. They call the pharmacy, they get the reorders, they pick it up. They completely manage your medications. On up to more complicated things, IVs, ostomy care, vents, and trachs. And then kind of something that is, I guess, trendier these days are care managers. And probably in the last, I've heard more of them in the last 5 to 7 years. A care manager, I think a lot of us hear of them in the hospital. We deal with care management, discharge planners, but a care manager in the community is really kind of a family advocate. The world we live in today, a lot of us don't have our children living in the same town. So families are more spread out. And so a care manager can kind of be that family representative, going to doctor's appointments, helping fight some of those insurance battles. The difference in a care manager taking you to a doctor's appointment versus having a caregiver drive you to a doctor's appointment, a caregiver is going to drive you, sit with you, make sure you go in and get you home safely. A care manager can take notes. They can ask questions, and then they can follow up with your family. So if there is a concern, if there's a new diagnosis, if you're battling some kind of illness, that care manager asks the questions and then can let all 4 of your children know this is what's going on. And a care manager is more of a big picture. How do we keep you healthy? How do we keep you active? What services do you need? And how can we get you to those services? Pricing. I always get asked about pricing. And so this is just some general ranges. For a caregiver, you have a couple of options. You can hire someone privately. There are lots of websites where you can hire someone privately. A lot of times people within a church or certain organizations, once they find someone good, they'll share that name with their friends. If you're hiring someone privately, you're probably going to pay anywhere from about $13 on up to about $20. Versus if you go with an agency, it's anywhere from about $20 on up to $28. Why such a range? Caregivers can go back and get extra certification where they can do some of those higher level tasks, like work with catheters, work with some vents. And so as they get more certification and can do higher level tasks, there's usually a higher charge for them. Benefits of being with an agency versus hiring someone off the street or off of an ad. An agency is going to interview. They're going to do background checks. They're going to do drug screenings. They're going to carry liability insurance and workers' comp insurance. When someone is being hired privately, those things are not covered. So that helps explain the difference in the price. The other piece is if you're with an agency and someone calls out, we're all going to want to go on vacation and we're all going to get sick at some point in our life. So with an agency, you have a greater chance of them being able to find someone to replace your caregiver. If you have a private caregiver, you probably aren't going to have any options for a replacement until they're better or back from vacation. If you need nursing level services, there's LPNs, which is a licensed practical nurse, and RNs, registered nurses. And those go anywhere from about $50 an hour, or some nursing visits are about $100 a visit. Wound care is a big one that nurses will come out and just do a visit charge and take care of a wound. And then care managers, it's anywhere from about $100 an hour to $150 an hour. But a care manager, you're not going to need quite as much as the other caregivers. So it's a higher charge, but the service isn't needed quite as much. This is one of my favorite alternatives, adult day care centers. And so, again, there are a lot of them in the Triangle area. The cost will vary, but it's anywhere, probably the lowest I have found. It's probably about $60 a day, on up to about $100. And it's kind of like what you think of with a child daycare center. You drop them off and you pick them up. They usually offer very flexible schedules. So I could get a Monday, Wednesday, Friday if I wanted. Or I could get 5 days a week, half days, 5 days a week, full days. Some offer showers. So if you have a spouse and they need help with a shower, and that can just be very difficult from a whole fall standpoint, that can be very difficult. So a lot of them will help with showering. They provide snacks, they provide meals. But the big thing here is it is a group of seniors coming together, and they have activity and entertainment. And this will allow the spouse or the child who is taking care of mom or dad to still work and know that their loved one is safe and taken care of. And it is a cheaper option than having someone come in your house. So after adult daycare, the next option is independent living. And this is where I'm at in the world right now. And so independent living, no one on my staff is a caregiver. We are providing more emotional support, social support. So why do people choose independent living? Well, number one, there's no upkeep on the house anymore. We take care of all that. It is all-inclusive pricing. And so the price I quote you is your TV, your phone, your internet, your lights, your trash removal, meals in our dining room. It is security. It is the security of knowing that we have someone at our desk 24 hours, 7 days a week. So one of those disadvantages of being at home is if you fall on the floor, no one's checking on you. Independent living, we check our roster every single day. And if we haven't seen you or heard from you, we're going to call you. If we don't get you, we're going to come knock on your door and use a key to come in and make sure you're okay. Socialization, activities, events, housekeeping. Every kitty is different. Some do weekly, bi-weekly. Meals, some you can buy into a package. Some it's 3 meals a day. Transportation is huge. So independent living, we do transportation to doctor's appointments. We do grocery trips. We do outings to gardens and museums in non-COVID times. So for those people who can no longer drive due to a diagnosis, medication, this is a chance for you to come live somewhere where we're going to take you where you need to go. And then most of the independent living communities will have supportive services available to help you age in place. Aging in place is now one of those trendy words. So supportive services, what are those? That is having that home care piece. Legacy is a big provider in the Triangle. They come into communities, they run an outpatient clinic here, and they provide physical therapy, occupational therapy, and speech therapy. And then a lot of us have partnerships with those home care agencies so that you can purchase what you want there. And what I mean by that, if you need help getting up in the morning and taking a shower, you can buy an hour of care here through a caregiver. It's not through the independent living staff. They come to your apartment, help you with your shower, and they leave. And so it's a great alternative to assisted living. Pricing, we are all private pay. Insurance does not cover this. And you're probably in this area going to look between $2,800 a month on upwards to about $6,000 a month for independent living. Your next step is assisted living. So the differences in independent and assisted. At assisted living, there are caregivers there 24 hours, 7 days a week. So there will always be a caregiver on staff. There is a nurse who oversees everyone's plan of care, but that's usually a 40-hour-a-week nurse, a Monday through Friday, 8 to 5. The nurse goes home. Now, when he or she goes home, there is still a caregiver, one of those CNAs in the building. So if you were to fall, there's someone who can come help you. So there's just that peace of mind and that safety concern because you will be checked on. They do an assessment when you come in. So assisted living, they want to know what your health is and what you need help with. Independent living, we do not. We don't do assessments. You tell us you can live independently, we welcome you in our door. Assisted living is going to have meals centered around medical conditions. So that's where you're going to get your low sodium, low fat, special heart health diets. They still have that socialization piece. They are 100% medication management. They take your medicines the minute you walk in the door. They make sure you get them. So you do not have to worry about medications the day you walk in the door. You turn it all over. Transportation, they're absolutely going to get you to your doctor's appointments. Most assisted livings will have a separate memory care unit. And this is a locked, safe environment. Looks exactly the same as assisted living. There's usually a dining room and a living room, activity rooms. But the residents of a memory care unit cannot get outside where they could fall and no one see them or get hurt. Most have an outside area that residents go to with supervision. And these are private pay for the most part. There are a couple that will take Medicaid. Most that I'm aware of, if they will take Medicaid, they want you to come in while you have money. They want you to do what's called a spend down to qualify for Medicaid, and then they will transition you over. But they cap it just due to the reimbursements from Medicaid. So you may hear the term, we only have 2 Medicaid beds. And so they will not let but so many people who need Medicaid come in. Pricing is probably about $3,500 on up to about $10,000 a month. Most, it's a joint room, so you have a roommate. There are some though that will give you the option of having your own private room. And here's the big difference we talked about with home care. Assisted living, it is one caregiver taking care of anywhere from 8 to 10 to 12 during the day. And then at nighttime, it could be one caregiver in the regular assisted living overseeing 20 residents. So they're there, but if you need help going to the restroom at 3 in the morning, you press a button for them to come to you. And if they're helping someone else, you have to wait till they're finished. So that's kind of the offset and why the pricing is cheaper than if you had home care, one-on-one, 24 hours around the clock. Home care, they're only taking care of you. Assisted living, they're taking care of a lot of people. Your next option is skilled nursing. Most people do not need skilled nursing, but it is there. Skilled nursing kind of has 2 components, a short-term component and a long-term component. The short-term is where most people go. That is for rehab. That is your knee replacements, hip replacements. It's where you're going to get all those therapies. A skilled nursing community has a nurse on site 24 hours a day. So that's your big difference. Assisted living, she goes home at night. Skilled nursing, there's always a nurse there. So because of that, they're taking a higher level of care type patient. Insurance will usually cover your short-term stays. So again, that's that rehab piece. If you need a long-term bed, Medicaid will occasionally cover. Long-term care insurance will cover, but most of the long-term stays are private pay. A long-term bed may be someone who needs stroke recovery, wound care, higher level wound care you'll see in skilled nursing. And then kind of these acute medical conditions, oxygen. I have a resident here who is maxed out on the highest level of oxygen. So if her oxygen level changes, she will have to go to skilled nursing. She cannot go to assisted living. They can't take any more than where she's at right now. Sliding scale insulin, where it needs a nurse to do a blood draw, see what your blood level is. Those most assisted livings are not going to touch that. You need to be there where there's a nurse around the clock. And then if you're needing IV therapies, those are definitely a skilled need. And then kind of wrapping up, continuous care retirement communities. These are usually called CCRCs, but it is one of the newer and again, more trendier options in the senior world. A CCRC, their promise is you move into this community and every level of senior care you're going to need is here. So most want you to come in independent. And some will either, they do an assessment and they want to make sure you can come in and be independent for a set amount of time. And they want you to stay that way as long as you can. But as you need help, they offer a home care option, assisted living options, a skilled nursing option. Some have the memory care option. You come in and you live in your own home and you're buying this home usually. A house, a townhouse, a condo. There are some that have apartments that you rent. And the promise is you don't have to leave this community if you need more care. You pay an entrance fee, and in this area, those are anywhere from about $100,000 on up to $1 million. Plus, on top of your entry fee, you're still buying your house or making a monthly rental payment for that rent. But it is a premium level of services, amenities, and activities. And what I mean by that, my independent living community, we have a dining room, we have a theater room. Well, at a CCRC, they're having ballrooms and grand dining rooms. It's just a different, much higher level. They're beautiful. Things to consider. Sometimes that entry fee is paying for, part of that promise is that if you need the skilled piece, it will be cheaper than if you're buying it out in the community. All right, now you can flip to the next one. Some facts I would like to leave you with. 85% of family caregivers do not reach out for help. That spousal to death do we part, I can handle this. Yet 70% of family caregivers report experiencing depression. 50% of spousal caregivers die before the spouse they're taking care of. And that is a huge, that's a big factor to consider. 50% of the healthy spouses die before the person they're taking care of. More older adults go to that nursing facility due to caregiver burnout as opposed to them getting worse and needing more help. And then most family caregivers report that caring for an older family member is one of life's most miserable experiences. And I say that, and I'm going to tell you, that does not mean that they did not love their family member. It did not mean that it did not mean something to them, taking care of them. But once you get through that journey, they're usually worn out, in bad health, and will step back and say, wow, I wished I would have done things differently. So the point today is to plan. Plan, ask questions for a better tomorrow.
That was awesome. Does anybody have any questions before we move to phase 2 of this presentation? If you have anything you want to put in the chat, we're happy to address it. What I will do is start my presentation, and if any questions pop in, maybe we can pause. Bear with me. All right, so let me share my screen with you. And so while Barbara spoke a lot about the different living options and care options available, there's a lot more that also goes into this. There's a lot of different industries that cross Barbara's industry, and a lot of those things go hand in hand with one another to create a seamless transition into long-term care. I'm going to kind of talk to you about the kitchen sink, right? Like a little bit of all the little pieces that, from the legal perspective, that go into the equation that then meshes with what Barbara does, with what care managers do, with what other family members do, and how it all combines together to form a long-term care plan for you or your family. So, so the first thing I want to tell you a little bit about myself. I'm an attorney. I do almost exclusively estate planning, probate, adult guardianship, basically planning for the day when one becomes incapacitated, planning for that ultimate passing away, and transfer of assets, and planning for your care while you're unable to make decisions and communicate those yourself. I run the estate planning department here at this firm. I've been doing this about a decade. I also hold a life insurance license, a health insurance license, a long-term care license. I'm VA accredited. I'm a certified mediator for estate and adult guardianship disputes. I'm credentialed out the wazoo. And so I wanted to touch on just a few things that aren't directly in the legal field or in some of those other areas. The first is what kind of products and things are out there that can help you finance this proposition of having someone care for you in your later years. The first thing I wanted to make sure I mentioned was the long-term care partnership program. So there is a program out there, Medicaid, that will kick in at a certain point when you become impoverished enough where you just can't afford the cost of care anymore, and Medicaid will kick in. We'll talk more about that in a bit. The long-term care partnership program is basically a very specific type of long-term care policy that meets the criteria that our government has set up. And if you buy this, let's say you buy a $100,000 long-term care partnership program, and you're allowed to have $2,000 of assets under the Medicaid program. What this means is once you've exhausted your long-term care benefits and it's time for Medicaid to kick in, you're allowed to keep the Medicaid amount, $2,000. You're also allowed to keep the $100,000 in value of property that you have. So if your primary goal is to make sure that the assets you've collected during your lifetime go to your survivors, then you can buy a long-term care partnership program policy to help mitigate that risk. And so you can basically have your cake and eat it too. You have long-term care insurance, you may get Medicaid, and you can preserve a good number of your assets equal to the payout of the long-term care policy. One of the more common things that I see, though, that people do to prepare for long-term care needs or to long-term care costs is they get a life insurance policy. That's just, in all other respects, just a life insurance policy. You pay a premium, you die, you get a payout at some point, right? The life insurance policy can have a rider that you pay extra for, so your premium would be more than it would be otherwise, but it gives you an additional benefit to the life insurance. So if you're determined to meet the eligibility requirements, which is usually a certain number of ADLs or activities of daily living you can't do yourself, then the policy will kick in and it will count against the death benefit. And I will tell you, it's usually for people who are planning for long-term care needs for shorter durations, usually fewer than 10 years, and it doesn't usually account for inflation. So the value of $1 right now, is $1. That same dollar may be worth, $3 by the time you need long-term care. So you got to have to keep that in mind when you're planning for that. Some people are, I interview them, we're talking about long-term care planning, and they have just millions and millions of dollars of assets set aside that they could not possibly exhaust if they needed long-term care. I would say it does come at a risk for most people using their personal savings to plan for long-term care, because it's if preserving assets for the next generation is not a goal for you, which it isn't for everybody, then it's possible you'll still run out of money and you'll need Medicaid. And if that were to happen, all of your income would get sent to the nursing home, and then Medicaid would pick up the difference. And then you get about $30 off the top to pay for co-pays and shampoo and all the stuff that you need to get by, which is hardly adequate. So if you're able to, use your savings, you're going to be using it for more than just the cost of your care. You've got these extra things that you'll need. And what you don't want to happen is you run out of money, and then Medicaid has to kick in, and now you don't get all the things that you need, or that you're not living up to the standard, the lifestyle standard that you're used to. And in older ages, that could be a real challenge. Now, traditional long-term care policies have got sort of a bad rep. I think when they were originally introduced several decades ago, the insurance companies grossly undervalued, what it would cost to provide these policies, and some of them went bankrupt, and others just quit carrying the product. And so it's harder to find a traditional long-term care policy. There are still some companies out there that do it. You can customize those long-term care policies to provide for certain kinds of care, a lot of the different kinds of care that Barbara mentioned in her presentation. But it is harder to find, and the premiums are usually subject to change. So it's one of the things that you'll learn in the long-term care arena is, am I paying for a product that I know what I'm going to pay from now and forever? Or is it a product that will every year or every couple of years, is it going to inflate on me based upon market conditions and other factors? So you want to investigate that before you sign up for a long-term care policy. The final thing, as far as products, I guess, is government assistance. So There are three I just wanted to touch on. One is special assistance, which is, I think Barbara was mentioning, sometimes there are Medicaid beds in the assisted living facility. This is what it's referring to as special assistance. So for assisted living level of care, you do not normally get government assistance. There's an exception, and it's a state program called special assistance. And what that is basically, if you have incredibly low income, Medicaid will kick in a certain amount above that and place you in, and you'll be placed in a facility that's assisted living level of care, and your income that's insufficient will be fixed by the special assistance program, and they'll kick in the difference. The problem is that it's an extremely low reimbursement rate, and so assisted living facilities that sign up for this aren't going to take very many of them because they do pay so low. So there's a handful of different tools that are kind of in my tool belt, and that should be in your tool belt when it comes to facing long-term care planning. And some of them are not intuitive. So I kind of wanted to touch on a little bit of everything. The first would be estate planning. There are things that you can put in place now that are going to help you when it comes time, when you're in the moment of crisis. And these are usually documents which either control where assets go in a way where a loved one won't become disqualified for government assistance if it becomes relevant. There's also things that you can prepare that will give other people the authority to handle your assets when you can't handle them for yourself, and be able to handle your medical care when you can't handle it yourself. And that's just fundamental estate planning. You know, someone walks in the door and they go, I need an estate plan. There are certain things I know they're going to get in 99% of cases. And it's the same 3 or 4 things that just about everybody needs. And then if they need more complex planning, we jump above that. Government assistance planning kind of goes hand in hand with estate planning. A lot of times that happens at the same time. And what that is basically, for government assistance, we have a very, very complicated set of rules. And think of Medicaid as being sort of the primary government assistance program that exists out there for long-term care. There are a few others, but this is the one that a lot of people come in and they go, I need to get Medicaid for my mother. What do we need to do with her stuff so that we can get that sooner? And basically, Medicaid planning is, in a nutshell, working your way through the rules that exist that prevent people from getting Medicaid until they reach a certain level of impoverishment, and shifting assets and doing special kinds of planning so that your assets now wiggle around the rules and fit into exceptions. And so a lot of times the Medicaid planning we do will look completely arbitrary. It's stuff that people would never do just to do for the most part. But the reason that we're doing it is because it will recharacterize an asset as something that doesn't disqualify them on the front end to get Medicaid, or it protects them from Medicaid estate recovery, which I'll come back to in a minute. So a lot of times guardianship, adult guardianship, is something that crosses with what I do on a day-to-day basis. And that guardianship is something that comes into play either when there's very poor planning or no planning. And we need authority over a person's affairs to handle personal care or handle financial affairs, but we don't have anybody out there in the world with legal authority to do it because of no planning. There are also times where people misplace their trust in others in their estate planning, where they give people that aren't trustworthy the authority to handle their affairs, and then they go running off with it. And someone else in the family has to step in and seek guardianship so that they have the authority to seek relief on your behalf from the people that wronged you. So sometimes it's necessary for that reason. As much as we try to avoid it, sometimes when people get illnesses, like certain forms of dementia, where they don't actually have insight into the fact that there's something going on with them and they aren't making clear decisions, and they think instead that it's other people that are confused about the appropriateness of the transactions and the things that they're doing. And so what you get is someone who's actively undermining the authority they previously gave you. And so if they're doing things to undo, or they're not cooperating with your efforts to help them, then sometimes you have to seek guardianship to protect them from themselves. And so that's a big part of what we do here too, is either trying to prevent that from ever happening, or if it needs to happen, guiding people through that very complicated process. The last thing I will say is everyone should have a playbook. And when I say a playbook, I mean things that cover all your accounts, social media passwords, where your dog goes to the vet, what credit cards do you have, things that if you just fell out unconscious today and someone needed to pick up the pieces and continue managing all of your stuff for you until you regain consciousness, what would they need to know? And having all of that in one place, whether in an informal format or you're following a directory that gives you all the things you need to check off the list, I think you need to have that with your estate planning or Medicaid planning documents, with your important documents, so that anybody picking up the pieces in a moment of crisis will know exactly where all your stuff is and what they need to go looking for and what's missing. That's very important too. A lot of times people die with insurance policies that nobody else knows about. And 10 years later, we see it in a sheeted property record for the state. And we go, oh man, well, that would have been nice to know about 10 years ago. So I'll start with estate planning. So, and I'll just kind of hit the highlights here. So, a last will and testament sounds like it's something that would not have any import in the process of planning for long-term care, but it actually does in a non-intuitive way. A will gets rid of your stuff when you die, decides who gets what and who's in charge of your estate. But from a spousal perspective, a lot of times wills do come into place when we're doing long-term care planning, because what we don't want to happen is for someone to qualify for government assistance and then their spouse dies and leaves everything to their surviving spouse, or someone else dies and leaves everything to their dad or their kid who's in long-term care. And now all of a sudden they've got too much money and they don't get the benefit of the government assistance, and now they got to spend down their inheritance before they can get government assistance. We can create wills and other tools like wills that have mechanisms built into them that prevent that from happening. So a will is a really good long-term care planning tool for other people that you were going to leave property to who may end up needing long-term care. I would say a durable general power of attorney is probably the go-to, the most important document that you can have for planning for your eventual incapacity. That is a document that grants to another person broad authority to handle all of your financial affairs. I mean, you can draft these things that are incredibly broad in scope. I mean, I tell people you can have a power of attorney that does everything other than make a will, vote, get married. That's pretty much it. I mean, you can have extremely broad powers of attorney that grant authority over affairs to other people that you trust. So a common question I get is, am I giving up my rights when I do that? Typically, no. What you're doing is you're saying, it's like having a copy machine and saying, okay, I have all these rights as a person and as an American, and I'm going to make a mirror copy of some of those rights, and I'm going to give those rights to another person, and they're going to have a copy of those rights and some of my rights, and they can sign things and do things for me, and I also can still continue to do them for myself. What I really like about that arrangement is, unlike a guardianship where we have to prove that someone's mentally incompetent, which means we have to wait till they get to a certain stage of regression or a certain stage of cognitive decline before we can do that. And so in the meantime, they might start doing things to undermine their own estate planning. They might be vulnerable to exploitation. They might be leaving food out for days or letting stray cats in. There's all kinds of stuff that happens when you start to lose your cognitive ability. And so having somebody in the wings who can, as your cognitive ability declines, who can step in and handle one thing for you, or handle a couple of things for you, or handle some things as you need them handled. It's a far better process than a guardianship, because it can be gradual, right? Where you continue to maintain the independence of the person that gave you the power of attorney. You can just jump in when you need to, and eventually you may end up taking over all of the affairs of that person that gave you that authority. But it can be over a period of time, and they can maximize their independence, which is so important for people who are having cognitive decline or elderly, have lived their own way, their own right way for their entire life, and to suddenly put that in the hands of somebody else is a difficult thing to do. So to do it gradually is, I think, helpful for them. Healthcare powers of attorney and living wills basically are the same thing, but for medical care, right? It says, when I can't make my medical decisions, this is who makes it for me. And when it comes to the decision about whether to withdraw or withhold life prolonging measures, in the moment when I'm at the cusp of death, these are my wishes, and these are my wishes about what my agent does with my remains. It covers a lot of ground related to your health and after you pass away. The other thing I would say is an important estate planning tool for long-term care planning or trusts. I will say I'm in the minority. I think a lot of attorneys think that everybody who has a pulse needs a trust to avoid probate. I have a little bit of a different philosophy on that. There's certainly some flags for me for people who need trust planning. If a priority for you is long-term care planning, trust may be a tool that gets brought up among other tools, and it helps for a seamless transition after you pass away. That's sort of an ancillary benefit, but it has a lot to do with incapacity planning. So when you have a trust that holds property that you own, and then suddenly you become incapacitated and can't manage that trust anymore, you'll have provisions in the trust that provide for who takes over in the order that you want them to serve. You can have provisions about the scope of their authority and who they're required to consult with. You're basically given the keys to deciding how things are happen after you lose the ability to do it. And a trust is a really good mechanism for having that level of control. It also allows you to have more dead hand control after you pass away, sort of an ancillary benefit. And that's actually the legal term. It's not something I just came up with. And what that means is putting conditions on inheritance. So I may want my son to get, his half of the inheritance once he completes a Dave Ramsey Financial Peace University class and takes a handgun safety class. You can put all kinds of conditions in there to make sure that the people who are getting the inheritance that you're giving them, adhere to certain eligibility requirements that you think are important for them. And also, after you pass away, it's generally speaking, there are exceptions to every rule, but generally speaking, it's a much faster administration process. The average probate process in North Carolina might take 6 months, a year, maybe 2 years, depending on several factors. But, usually a trust can feasibly be handled in weeks instead of months. So I want to talk about, I touched on it a moment ago, but I want to talk about government assistance planning. So the first is the special assistance, which is only if your income and assets are extremely low. There's not a whole lot of planning we can do on the front end for this. It's sort of like, oh, well, let's look at your income and see if you might qualify for that program and send you over to social services. And so we're talking like less than $1,200 a month, I think, in income. It's extremely low threshold. And so a lot of people don't qualify for it, but it is the government program that helps pay for assisted living, which is what a lot of people need. There's also VA benefits available for veterans. They have to meet certain eligibility requirements as far as how infirmed they are and how far along they are. But, there are eligibility requirements, but there's this thing called aid and attendance benefits that allow veterans to get additional support for things like skilled nursing care and other types of care or homebound care. Medicaid planning is sort of the biggest one. There's no income limit in North Carolina. And I will say that basically Medicaid's a federal program. And I would say the best way to think of it is they give a bunch of options and ranges of things for the states to pick from. And every state has picked in different options and has different ranges for incomes and assets. And if you Google any of this stuff, it will come across as completely confusing because, one article will say this type of trust works. Another article will say this type of trust doesn't work. And it's incredibly confusing. And sometimes people ask me about things that I've never even seen or heard of as an estate or as a Medicaid planning tool. And then I go and I look it up and I realize it's something that's unique to Nevada or something like that. But basically, in North Carolina, there's no income limit. There's just an asset limit, so a $2,000 asset limit, and not everything counts towards that. So you're allowed to own a car. You're allowed to own, I think you're allowed to own a irrevocable burial contract. You can own a whole life policy up to a certain amount. You can own, you can have clothes and shoes and jewelry. There's all kinds of rules about things that you're allowed to have despite this $2,000 asset limit. The way the income works is basically your income goes subject to a little bit, set aside for you, goes entirely to the nursing home, and then Medicaid kicks in the difference. So as long as your income is below whatever the cost of care is that Medicaid's negotiated, then they kick in the difference up to that negotiated amount. The other thing to keep in mind from a Medicaid planning perspective, which often involves trusts, it often involves shifting assets around and buying things and spending money down. There's two components. There's eligibility, right? So people come in and they go, I want to be eligible for Medicaid. A great example is typically the primary residence in North Carolina does not count against the person for eligibility. But after you die, or after the person dies, or after they and their spouse die, in the case of a married couple, Medicaid will then file a claim against their estate and will force the family to sell the home to pay Medicaid back, which in almost every case depletes all the equity in any sort of home, because often these folks are, these claims are for $200,000, $300,000. I mean, I think the smallest one I've seen in the past 6 weeks is for like $48,000. So a lot of my time is on the back end trying to find technical defects so I can defend against these claims. And I've been successful sometimes, but sometimes we just got to sell the house and turn over the check to Medicaid and do the best we can to try to pull out what we can to get our client something out of the deal. And so a lot of times people don't realize that they go and apply for Medicaid, and they don't realize that there's two components, and they get Medicaid and they go, oh, this is great. I'm able to pay for the cost, the cost of care is being provided by someone else. But then that claim gets filed and they got to sell everything to pay Medicaid back. So a lot of times what we do is planning that both helps people get eligible quicker, despite technically having assets that might otherwise make them ineligible. So we get them benefits sooner to preserve those assets for themselves or their family. But then we also will do planning to keep estate recovery from having a lawful ability to go after the remaining property to sell after you die. So those are the two components that we usually will do in Medicaid planning. So I mentioned guardianship. So guardianship is, think of it as like, if my grandmother all of a sudden developed dementia or developed some sort of infirmity that prevented her from being able to manage her own affairs, and I felt like I could prove that, what I would do is I would file a lawsuit against my grandmother. And that lawsuit is called a petition for adjudication of incompetence. And at that time, what will happen is I will allege facts that show to a fact finder, like a juror or a judge, that this person is incompetent by clear, cogent, and convincing evidence. And a lot of times that involves the use of medical records. It often will involve anecdotal evidence by witnesses who can say, oh, grandma did this and grandma did that. And grandma's sitting there and she might not have full capacity, but she may understand what's going on. And it can be very embarrassing. Also, there are often fights among family. I see this in the mediation circles. You get a lot of people who have either ill motives or very well-meaning motives, right? There are, 5 children. They all have a different opinion about what should happen with mom. And a guardianship is a forum in which they can duke it out, and the judge will have to basically figure it out for them. And that can be very challenging. A lot of times what ends up happening is the fighting gets so bad that the judge appoints somebody that the person never met, like another attorney or social services or one of the companies that social services contracts to, like private guardians that can be paid for their services. So it's not an ideal platform to rely on for long-term care, because you really have very little control over what the outcome is. But it's a lawsuit. And so then there will be a court hearing. And then if the court determines that the person's incompetent, they'll appoint a guardian. And it could be a guardian of an estate, which is just control over the money. It could be a guardian of the person, which is not control over the money, but control over everything else. It could be a general guardian, which is control over everything. There are also limited guardianships where a person may retain the ability to handle small amounts of money, or may retain their driver's license. And by the way, anytime you file an incompetency proceeding in the absence of an order saying otherwise, as soon as that incompetency order is entered, it gets sent over to the DMV and the person's license is revoked. So there's a lot that goes on here that has different non-legal aspects in terms of the what are you doing to that person, and when you have them declared incompetent, which is in itself is a pretty salacious term. But when you're appointed guardian, depending on the type, there may or may not be a financial component, but typically you have to maintain a bond, which is just an insurance policy to insure against the risk that you run off to the Caribbean with their money. And so you have to pay a premium out of their funds for that. Typically, you'd be responsible for managing their property, which means every year you have to report back to the court, pay a filing fee, provide supporting documents showing what happened in the previous year. And that may sound like a good safety measure, but I will tell you it's incredibly tedious. People come to us and, maybe their mother has $20,000 to her name, but I've got 8 inches of paperwork that I have to submit to the court to show how much we spent on toilet paper and haircuts, and and we got to support all of that. And the court will go through line item by line item and make sure that we are spending that money appropriately. It's incredibly tedious, and it can get very expensive. There are a lot of filing fees and things associated with that. And then, of course, if you need bookkeeping help or legal help to get through that, then you'll have additional fees on top of that. So basically, a power of attorney will often prevent this whole thing from ever becoming necessary. So I would say of all the stuff we talk about, a power of attorney is something everybody needs. So anytime that you have to modify a guardian, you got to go back to court and you say, hey, I'm sick. I need to have somebody else appointed. And then, there are some things that you shouldn't do, that you don't have authority to do. As a guardian, you usually can't sell more than $5,000 of personal property in a year. You usually can't do anything really of substance with real estate without going back to the court and petitioning it and noticing all the parties and having a full hearing. Any procedure, any medical procedure that you consent to on behalf of your ward, that's what we call the incompetent person. Any medical procedure that involves, whether just as an ancillary part of it or as the main reason for doing it, anything that involves sterilization, you have to go through a lot of channels to get the approval to do those things. So typically I have to get letters from a psychiatrist or affidavits from a psychiatrist and affidavits from a primary care. I mean, it's a fairly involved process. If if all of a sudden, mom needs a hysterectomy or something, it's a lot, there's a lot of work that goes in behind the scenes, a lot of paperwork that would hopefully be avoidable. And so the thing I wanted to share with you is the playbook thing. So, for me, I have a 3-inch notebook. I've got every beneficiary designation, every recent bank statement, information about accounts and deeds and all the stuff that makes up my estate. I have information about, and I also have some details about how I want to be turned into a tree pod, and I want hot patootie by Meatloaf played at my funeral, and all the stuff that people, want to make sure other people are aware of. So but if you just don't feel comfortable doing that, knowing what all to get, there are books you can buy. And they're given usually hokey names like Peace of Mind Planner and stuff like that. And basically it's books of blank lines where you can just go through and write it all in, exactly what all the information that somebody might need to know would be. Or you can just use that as a guidebook to figure out what documents you want to put together. So rather than telling my clients they should buy one, I wrote one. And I wish I could, my grandfather always said he wanted me to write a book one day. I don't think he knew that it was going to be a book full of blank lines, but I did. And I put it on this website. So you can just go to that website. You can download it completely for free. There's no cost associated with it. In fact, anytime we do an estate plan for a client, we include it with their plan. Just say, hey, this is helpful for some people. So here it is. Basically for any type of estate plan we do, that goes into the packet. I think it's very important to have because we live in a world where it's no longer possible to deal with someone's estate by just checking the mailbox. There's so much that happens electronically that it's just sometimes, we could go years without being able to find stuff. And there's always stuff that we don't find. And so even, I have an arsenal of tools to help me track down assets. I've got private investigator software. I've got private investigators. I got all the stuff that I would possibly need to find assets, and I still miss stuff. So I would say having that information with your documents is very valuable. You usually aren't going to put social security numbers and specific items for a lot of people in your will. You're not going to provide a lot of identifying information in a will because sometimes that can be a public record, and you don't want you don't want social security numbers and stuff. But it's helpful to have all that information for your executor and your trustee and all the people dealing with your stuff. And so having that guidebook there in a moment of crisis, absolutely vital. So you can download that for free. I think I covered everything. So Medicaid planning, estate planning, power of attorney being the most important, guardianship being something that sometimes we have to rely on and you need to be prepared for. And then that playbook. Those are the sort of touch points of what I do that crosses the field of long-term care planning. As a little plug for our firm, as I like to do anytime we have an event, anybody who attends an event and goes and plugs in the promo code, as you see on the screen, gets a percentage off. So if that's something that's of interest to you, if it's something that's been on your to-do list and you're just looking for an excuse to get it done, there you go. You can go right to that website and plug in the promo code, and it'll let you set up an appointment right with me, and I'll get an indication from my end that it's an appointment that should be subject to a discount. So feel free to do that. If you prefer to vet us a little bit more, feel free to give me a call, and I'm happy to entertain any questions about kind of how the process works and what we do and what the price points are and all of that. And we have all that on our website too, so you can check there too. I've been informed that my video is blocking the promo code. So the promo code is the # or hashtag event25, EVENT 25. So if you go to estatenc.com and use event25 with the # in front of it, you should be good to go. Did anybody have any questions? Well, if you think of any, you've got our information, just shoot your message to us, and we'll be happy to entertain any questions you have. Before we end this, Barbara, is there anything else that you wanted to add?
Nope. I think being prepared is the most powerful thing you can do, and the best gift you can give your family is
Amen.
knowing what you want and getting it out there.
All right. Well, I would invite any of you to ask any follow-up questions as you get to thinking about this stuff. A lot of times it's like when you go to the doctor, as soon as you leave, you go, oh crap, I forgot to ask that. The same thing here. A lot of times that happens. So just reach out to us, guys. And thank you for all of your time today.
Thank you so much for having me.
It's my pleasure. Bye, guys.
Bye.